When we get to more advanced prolapse, probably the best non-surgical option is to use something called a pessary. Now this is just one type of pessary. There are about 17 different styles of pessaries that we use, but very simply, a pessary is simply a device. They come in all different shapes and sizes and types for different types of anatomy, but that can be inserted into the vagina to help hold the bladder in position or the uterus in position and so on.
So it pushes up. Now, when you put it in, does it stay in the vagina, or does the person, the female, have to place that in every day, take it out at nighttime? What about
Right. Great question. This is where we really try to individualize it to the specific patient's wants and needs. I've got some patients who never touch it. I see them 2 or 3 times a year. We take it out, we clean it, we put it back in, and off they go for another 4 to 6 months. We've got other patients at earlier stages of life who do all sorts of physical activities, who place this and remove it on a daily basis. And so we will gauge the type of pessary we use and the instruction and training to make sure that any patients who want to be able to have complete control over it have that.
A pessary is a device that goes inside the vagina, a plastic device that has a knob on it that can kink off that urethra and help some with leaking.
Is it hard to place?
Not really. It depends on the mobility. Obviously, women with arthritis or obesity, people that would have a problem reaching, may have issues placing it.
Does it fall out? Do people, when they laugh or cough, will it fall out of the vagina?
Usually not, because you come in for a fitting and we fit you with the right size pessary for you.
Is that hard or easy?
To fit?
Yes.
It's actually pretty easy. It's just like a simple annual exam, however you would have that done.
Now, what kind of results do you get with a pessary from a patient that's had stress incontinence?
Really, I'd say the success rate's about 40%. It's
pretty
not
good.
very high, but it does help, especially in those non-surgical candidates.
So if it's one of those that fails, the pessary, what's next?
Well, the next step would be, now of course, before any type of surgery, which is the next step, we would want to do some specific testing.